Thank you so much. We'll move now to Sam James.
Thank you, Madam Chair and members of the committee, for elevating the importance of this topic and specifically for highlighting our experiences in Altadena with the Eaton Fire. As a former staffer myself, I would also like to extend my gratitude to the staff who ensured this hearing could happen today. Thank you. My name is Samantha James, or Sam, as most people know me, and Sammy to many in the Altadena community who raised me. I am 25 years old today, and I made the trip up here on my birthday to share the unfortunate realities we are facing after the Eaton and Palisades fires in January of this year. I am a co-founder and CEO of the Altadena Recovery Team, or ART, formed immediately after the fire, where we have provided direct relief to community members in Altadena every weekend. I am a current resident of Santa Monica, where I was an evacuee of the Palisades fire, but Altadena is my home. And it was, in fact, the place I was evacuating to when my dad told me about the Eaton Fire raging towards our home. I grew up in Altadena, California, where I am the sixth generation of my family to live in the area after we originally placed roots there in 1890. My family has seen the community through its many iterations, from when Orange Grove Boulevard was a sea of orange trees, to redlining and de facto segregation, to the beautiful flourishing of Black art and culture that is ever present in the community, and now to the devastation we are experiencing as a result of the Eaton Fire. As is the case for many Altadena residents, homes that were in my family for 60, 70, 80 plus years are wiped out. My grandfather's house that he worked 3 jobs to pay off and where I spent much of my childhood is nothing but a garage now. My own childhood home experienced extreme smoke damage as the fire raged in our backyard, burning down our horse stalls and tack room, where the tools my dad once used to build those structures now lay charred in heaps on the ground. As longtime Altadena residents, we have faced environmental challenges and pollution-related health disparities for decades. Many of my family members have asthma and lung diseases that already disproportionately impact Black and Brown communities and are now exacerbated by the wildfires we have experienced in our lifetimes. I personally have emergency evacuated 3 times and suffer from a lung disease and breathing disorder that dramatically worsens when I am around smoke of any kind, let alone the thick, toxic smoke that hung over Los Angeles and surrounding counties for weeks after the fires. While we've always understood the risks of living in this area, the severity of these fires has escalated dramatically due to climate change. The fires I experienced as a child pale in comparison to the near-apocalyptic destruction caused by the Palisades and Eaton fires, both to our communities and our health, still 2 months after the fires were extinguished. And it is not just our physical health that is harmed by these wildfires, but our mental health as well. 10 days after the fire, we lost our patriarch, my grandfather, who worked so hard to provide for our family until he was well into his 80s. When you experience that magnitude of loss, that intensity of grief, as I'm sure many of you in this room have experienced and can relate to, it is the physical reminders that often serve as a life raft. The hat he wore to my softball games, the photos of me sitting in his lap, the home he took us to after he picked us up from school. What do you do when you don't have any of those anymore? How do you heal from the compound grief of losing your community, your home, and your loved ones at the same time? How does a community move forward with the painful reminders settled in the ashes all around us? As the co-founder of the Altadena Recovery Team, I know that my experiences are not unique. Each week, we meet more and more families with their own stories of resilience, now struggling to find basic hygiene items, PPE, and other supplies to support their overall health and well-being. Families who want nothing more than to rebuild, nothing more than to breathe freely again, nothing more than to be treated as a human being and not an expense for insurance companies if they were even lucky enough to afford it in the first place. Companies that are now trying to push people, like my father, back into his home that is still standing, but are unhealthy to live in and rife with reminders of their trauma. As the larger donation centers shut down, as people find long-term temporary housing, cities, counties, and even states away, how will the state support community-driven efforts like ART that support the well-being of our neighbors waiting to rebuild? How will we ensure that toxic waste will not be dumped in areas where it will harm other communities, as is currently happening? Who is monitoring and protecting the health of residents still in the area as they are regularly exposed to toxic sites and experience the pollution of the never-ending lines of trucks that parade through Altadena, removing debris? Never could we have imagined the destruction we currently face in Altadena. But what I always knew is that we in Altadena would lift each other up. Our neighbors are not just our neighbors, they are our friends and they are our family. Despite this unimaginable loss, our community remains resilient, but we can't do this alone. So I ask you today, how is the state going to show up for us the way we show up for each other? Thank you.
Thank you so much, Samantha, and happy birthday. Thank you for being here with us and also for honoring the memory of your grandfather. I think I'm going to just put a sign on my wall. Fires don't discriminate, but systems do. And I think it's very, very powerful to hear both the experience that you are bringing into the room about the impacts of wildfires and the behavioral health components, mental health components, overlaid with the incidents of systemic bias that our community members are facing. So I just wanted to give you some space to just be able to make comment to that as well.
So I think specifically with the Eaton Fire in Altadena, we got lumped in a lot with Palisades and often overlooked between the two fires. And Altadena, especially in West Altadena, has a very large Black and Latino population, a lot of working families, middle-class families, lower-class families who can't afford to move somewhere else. I've had conversations with people in the Palisades who have just repurchased another home, and there's people in Altadena who are in homeless shelters. And so how do we rectify that? How do we ensure that as we're talking about all this information that's been shared today, this is some of the first time I'm hearing about it. I'm talking to people constantly and they're not getting any sort of contact. We haven't had LA County Department of Health reach out to anybody that I know of to check and see if their health is okay, if their home is okay. People are getting pushed back into homes if they're still standing, and the health impacts and the mental health impacts of having to drive past just massive devastation. If you haven't been there, it's really hard to describe, but it looks like a bomb was dropped on our community, and you can see blocks and blocks and blocks of damage from one vantage point. And trying to put that into words, trying to see that every single day as you're supposed to be going to what is your home when a community is your home is extremely difficult to describe. We have a lot of people, because we're a community drive, who are undocumented and monolingual Spanish speakers who come to us because we don't ask for identification in order for them to receive assistance. And when they go to the larger donation centers, so much that they still exist, because many of them did shut down, they're turned away because they don't provide those identifying documents because of the overall climate that we're operating within. And there's a lot of fear in the community, and we are there to try to dissipate some of that, but there's only so much that we can do, especially as a crowd-funded organization versus some of these larger donation centers who aren't thinking about the multi-generational homes. I'm nervous that people are going to shut down and they're not going to be open to support when it does come. And so that's definitely something that we've been concerned about and something that we've been experiencing every weekend that we set up. Rebuilding trust within the systems themselves will help with just that feeling of dread. Part of the issue in Altadena and the Eaton Fire is that only part of Altadena received notification that they should evacuate, and many people evacuated at 3:30 in the morning. Granted, I don't think that they necessarily thought the fire was going to go as far as it did, but people left in the middle of the night with nothing, not even their IDs. One of my friends, her dad left his passport and ID and every single document that he owned in his house because he was trying to get his family out. I think when we talk about trying to make sure that the community is prepared, we need to make sure that everything else is prepared so that when the community does have their go bag ready to go, that they receive a notification in a timely manner so they're actually able to grab it.
Thank you for lifting that up, Sam. In my community, the alert also did not go out. And so the whole community, knowing what had happened, went through the streets honking their horn to wake each other up. And I think there's this feeling when we have communities like ours that are Black and brown that don't get the notification, it does feel like what you had said before. These systems aren't in place for all of us. I did want to ask you, Sam, in that same vein, you talked about people not getting contacted by the Department of Health in LA County, but also the distrust with government. And I wanted to just ask, in your opinion on the ground, what do you think would be helpful? Is it LA County Public Health coming out and reaching out directly? Would that provide the level of comfort we're aiming for, where people do feel heard and supported and connected to resources? Is it some other thing, like more nonprofits on the ground as trusted messengers, just so that we can hear that feedback about, next steps to be supportive of our colleagues who do represent your area?
I think it's a combination of things. I definitely think that having the county department that is responsible for our health knocking on doors and talking to people, or at least doing some level of outreach, would be extremely important. Healthcare providers haven't reached out to many of my friends and family who they know live in the burn zone. And so when you don't have that level of outreach, there's not that conversation that's started, and people aren't willing to continue to open their doors to you or continue to open their hearts to you either. So I think that is definitely part of it. I also think utilizing community health workers, people who have been on the ground in the community for years prior to an event, who have that established trust with community members, have that established trust with local nonprofits and the government agencies that are overseeing it, utilizing them in a safe way, in a way that they're also protected and not going into areas that are going to put them into harm, but providing that outreach and doing it consistently, not just once and then we never see you again. Because I think that's also part of the issue, is if you have that one singular outreach and then nobody talks to you for years down the line, and you hear, oh, we did this number of outreach, we talked to 39,000 households. It's like, you didn't talk to my household. Like, what are you talking about? And so that fuels that mistrust, and that fuels that anger and resentment that a lot of community members are feeling right now.
Thank you for letting us know. And I just want to add my thanks for you sharing your day with us today to lift up your community's voice, and all of the panelists today. Thank you.